The action of acetylcholine on exocrine gland is stimulatory. Atropine blocks the muscarinic action of acetylcholine through competitive antagonism. Which one of these carbamate is used in glaucoma? That is carbachol. Which one of these alkaloids is used in ophthalmology? That is pilocarpine. Perinom is a common brand name. Perinom's common brand name is metoclopramide. The main use of epinephrine is in glaucoma. Neostigmine is mainly used in myasthenia gravis. DFP causes irreversible inhibition of cholinesterase. Which one of these anticholinergic possesses depressant effect on CNS? That is hyoscine. Antimuscarinic agent produced in eye, that is mydriasis and cycloplegia. Norepinephrine is synthesized in bodies from starting material phenylalanine. Catecholamine is metabolized by enzyme monoamino oxidase. Which one of these is an indirect acting adrenergic drug, that is amphetamine and ephedrine? Sugandrine is a common brand name for oxyphene-butazone. Due to long half-life, a single daily dose of one of these is sufficient, that is piroxicam. Which one of these is used in treatment of gout? Allopurinol. Which one of these is mu agonist? That is pethidine. Fortwin is a common brand name for pentazocine. In alcoholism, which one of these drug is used? That is disulfiram. Chlorpromazine is useful in treatment of schizophrenia. Stemetil is common brand name for chlorpromazine. Prochlorperazine. Sorry. Muscle relaxation is secondary effect of benzodiazepine. Tricyclic antidepressant act by blocking the reuptake of norepinephrine. In Parkinsonism, there is deficiency of dopamine. Levodopa is amino acid precursor of dopamine. The most potent CNS stimulant among xanthine bases is caffeine. Leptazole is stimulant of brainstem. Sugar part in the cardiac glycoside is responsible for water and lipid solubility. Toxicity of digitalis is increased due to depletion of potassium ion. Digoxin is useful in treatment of congestive heart failure. Inhibition, okay. Main side effect of thiazide diuretic is hypokalemia. Furosemide act on ascending limb of loop of Henle. Which one of these diuretic does not affect the potassium excretion, that is triamterene, amiloride and spironolactone? Glucocorticoids are used in treatment of inflammation and allergy. Oral contraceptives contain mixture of estrogen and progesterone. Typhoid fever is caused by Salmonella typhi. Which one of the antibacterial agent is effective against typhoid fever? That is chloramphenicol. The causative organism for pneumonia is Staphylococcus aureus. The effective antibacterial therapy for the treatment of pneumonia includes ampicillin and fluoxacillin. The sulfonamides are bacteriostatic in nature. Sulfonamides are effective against gram-positive and gram-negative microorganisms. Sulfonamides are generally metabolized by acetylation. Stevens-Johnson syndrome is associated with sulfonamides. Erythromycin act by inhibiting protein synthesis. Amphotericin B polyene antibiotic act by interacting with fungal membrane sterol. Nystatin is principally effective in Candida albicans. Which one of these is not an antiviral agent? That is harmycin. First line drugs for tuberculosis include isoniazid, rifampin, ethambutol, and pyrazinamide. Pyridoxine is administered with isoniazid to minimize the neurotoxicity. Rifampicin is produced by Streptomyces mediterranae. Which one of these antibiotic is effective in leprosy? That is rifampin. Combination therapy is adopted in treatment of tuberculosis to reduce the bacterial resistance. Niclosamide is used in the infection caused by cystodes. Parental pamoate is used against worm as it causes spastic paralysis of the worm. Which one of these is effective against Vibrio barrow? That is carbamazine. Metronidazole is effective in amoebic dysentery. The term bioequivalence means comparison of various formulations of same class of drug. Levodopa is converted in body into active metabolite. The slow metabolism of isoniazide in Africans due to genetic variation. Phocomelia induced by thalidomide is teratogenic disease. The concentration of pilocarpine nitrate used in the treatment of glaucoma is 0.5 to 4%. Which one of these is a diagnostic agent for myasthenia gravis, that is hydrophonium? Homatropine hydrobromide is used as mydriatic in the percentage of 1 to 2. Which one of these is used with hyoscine to induce twilight sleep, that is pethidine? Cardiovascular action of epinephrine is mediated through beta receptor. Which one of these has smooth muscle relaxant property? That is isosprin. Elupent is common brand name for orciprenaline. Ergot preparations are useful in migraine due to its vasoconstriction action. The drug of choice in status epilepticus is diazepam. Which one of these hypnotic possesses muscle relaxant property? That is diazepam. Which one of these general anesthetic is toxic to liver? Chloroform. Penicillin is inactivated by beta lactamase. Which one of these does not possess anti-Parkinsonism action? Carbidopa. Which one of these is useful in severe allergic condition in emergency? Dex, dexamethasone and adrenaline. Which one of these is a major tranquilizer? Trifluperazine. Valium is a common brand name for diazepam. Dose and frequency of administration of drug is determined by half-life of drug. Sodium nitroprusside is not used as hypotensive drug because it has short duration of action. Which one of these statement is true for prodrug? That is, prodrug is more active, it needs metabolic activation and it is less toxic. Coramine is diethylamine of nicotinic acid. The Streptomyces venezuelae produces chloramphenicol. The drug promethazine belongs to the category of phenothiazine. Niclosamide, which is antihelminthic, is used against tapeworm. Originally, oxytetracycline is known as terramycin. Drug products have many types of names. Of the following types of names that are applied to drugs, the one that is the official name and refers only to that drug and not to a particular product is the generic name. Which of the following is classified as belonging to the tyrosine kinase family of receptors, that is insulin receptor? Of the following, which is phase 2 biotransformation reaction, that is sulfate conjugation? Which of the following is unlikely to be associated with oral drug administration of an enteric coated dosage form? That is variability in absorption caused by fluctuation in gastric emptying time. So this is very long question. Try to understand the logic behind it. The greater proportion of the dose of a drug administered orally will be absorbed in the small intestine. However, on the assumption that passive transport of the non-ionized form of drug determines its rate of absorption, which of the following compounds will be absorbed to the least extent in the stomach? That is propranolol with pK 9.4. Similarly, this question is also very long. Okay.